Yeah, I think that there's always a fear, isn't there, of not doing something and then being blamed afterwards, being taken to the Royal College, being criticised by your colleagues. I think that is always a concern. I think that if you're working in a practice that has a practice protocol, it's probably quite hard to go against it, particularly if you're recently employed or a new graduate. But I do think there is a lot of discussion within the profession now, around contextualized care and taking that step to consider what is really in the interests of the pet in front of them and not just follow a protocol.
Welcome to The Consult Room, the podcast where we explore the evolving world of modern pet care. I'm Dr Paul Manktelow, a UK veterinary surgeon with a deep passion for pet health and welfare. In each episode, I'll be exploring key issues, challenging perspectives, and offering expert insight and practical advice. Because ultimately, my mission is to improve the lives of pets and the people who love them. Today's episode asks a big question. Are we over-treating our pets? As the cost of living continues to rise, many owners are finding it harder to afford veterinary care. And within the profession, there's growing debate about whether we sometimes rely too heavily on tests and technology instead of clinical experience and practical judgment. My guest today has spent her career championing a more pragmatic, welfare-first approach to care. Alison Thomas is the head of Veterinary Standards at Blue Cross, where she helps ensure high clinical standards while keeping treatment affordable and accessible. An experienced veterinary surgeon, Alison has worked across both private and charity practice, including several years with the RSPCA in Hong Kong, and is dedicated to providing clients with low-cost, pragmatic care that delivers excellent welfare outcomes. Alison, welcome to the Consult Room.
Hi, thank you very much for having me.
So you've spent your majority of your career in the charity sector. What first drew you to that path and what motivates you in your current role?
So I think I started out in private practice when I first graduated, did a couple of years working for a practice in Aylesbury. And then my next move was driven by a desire to travel, and I got a job in Singapore initially. That was also in private practice. I then ended up following a period of traveling in the RSPCA in Hong Kong. And although not run as a charity in the same sense as charity services such as Blue Cross, it gave me a flavour of what can be achieved in the charity arena as far as animal welfare is concerned.
So, Alison, you talk a lot about pragmatic veterinary care. So, but for the listeners, what does that actually mean in practice, and how does it differ from what people might think of as gold standard, for example?
Yeah, that's a really big question, and there's a lot to say about the definition of pragmatism and how it's applied. If you look for a dictionary definition of pragmatism, the one that I like best is one that talks about focusing on practical and realistic options rather than following a textbook. And that's what pragmatism means to me. Unfortunately, I think pragmatism has been equated with low value. And whilst it may be low cost and low resource, the value in terms of animal welfare and in terms of owners being able to manage and afford treatment can be absolutely huge.
So I guess in the profession at the moment, there's a term that's sort of been bandied around quite a lot, isn't it? So, and that's contextualized care. I mean, it's quite a complex term, isn't it? And I know vets would like to use phrases that aren't necessarily as easy to understand. But is there a key difference between pragmatic approach and a contextualized approach?
I don't think there is really. But the only thing I would say is that a contextualized approach could be going to a referral surgeon, for example, if the resources were there and if it was in the interests of the animal. So that could be considered contextualized. It may not be considered as pragmatic. For example, if you considered a dog with a complex fracture, you could contextualize that to go to a referral surgeon to have that fracture repaired by somebody who could do a really great job at repairing it. Or you could contextualize it and say, well, actually, we're going to be really practical and realistic here, and we're going to amputate that leg and get that dog back to exercising fully as quickly as possible. So I think it's similar. But there may be a slight difference in the breadth of it.
So we're currently in the midst of a CMA investigation in the veterinary sector, and they've identified that treatment costs are reported to have risen by around 60% since 2015. And there's all sorts of surveys going on and research being done by charities that are suggesting that millions of pets are missing routine care because of affordability. Do you see pragmatic care as part of the solution to that access crisis?
I think it's a huge part of the solution, to be honest. I think veterinary care is expensive because what we do is expensive work, and we need expensive equipment, and we use expensive drugs. And especially with the expansion of treatments and diagnostic options available, I don't think there's any hope really to make any of that much cheaper. I welcome the CMA's investigation into this. I think it's good that this is being looked at more closely. But I think the way out of this for the profession and for pet owners is to do less. Really, I think that's the only way to make treatment of pets more affordable. So look at the evidence for different treatments and tests and work out what they're really telling you and what they're really going to achieve in a welfare sense, avoiding doing tests that are not going to change the plan or the outcome. And similarly, avoiding treatments and surgeries that may increase life expectancy, but without necessarily increasing welfare, possibly even decreasing welfare. For me, that is the way that the profession needs to look to try and keep veterinary care as affordable as it possibly can be for our clients and their pets.
And I mean, I've worked in the charity sector for a couple of decades now, so it all just sounds very much common sense to me. But there are some complexities within the veterinary profession that we'll talk about in a second, because it sounds easy, doesn't it, that we should all be doing a little bit less, but there's a bit of nuances to it. So we'll get on to that in a second. But I did have a question about the sort of philosophy of pragmatism, as it were. So I guess some people might worry that lower cost care means lower quality. You did touch on that as before. So how do you reassure them that pragmatic care can still deliver the same welfare outcomes?
I think it's probably by example. So looking at things from a welfare perspective, focusing on that welfare and what you're really trying to achieve in the long run. Part of my background, as you mentioned, was working for the RSPCA in Hong Kong, and that was a very interesting experience. We each vet would see 50 consults per morning. So we had just short of 5 minutes per consult, and obviously we didn't speak the language, so we had translation to deal with in that time as well. So it was really a fire brigade service in many ways, and we treated what was in front of us. So we treated pain if there was pain, we treated skin disease with prednisolone if we had a really itchy dog. We did relatively little diagnostic testing, did plenty of surgery, but again, it was all very pragmatically orientated. It was just, this is a bad fracture. Let's amputate the leg. We don't have the time and resource to fix it. Admittedly, this was back in the 90s, so there were less options, significantly less options available then. So it was easier to deliver that kind of service. But it showed to me that if you haven't got much time, if you haven't got much money, there's still an awful lot you can do for that animal, and you can make it feel better, and you can make the owner feel that they've done something beneficial for their pet, and they don't need to consider perhaps having to give up their pet or having to euthanize their pet. So that was part of my background. The other sort of significant part of my background came from when I first started at Blue Cross, and Blue Cross at the time delivered veterinary care completely free of charge. There were no charges at all. And when I started, I thought this was amazing. This is really wonderful. Didn't have to discuss cost at all. But then I quickly became a little bit uncomfortable, because it was during that time when the number of options for treating and for diagnosing was increasing exponentially. And I began to think, well, this is really difficult, because I don't know what is a good use of charity resources and what isn't, because I'm giving all of this away. And I also don't know, if I decide to be a little bit more pragmatic, I don't know what my colleague in the next consulting room would choose to do. And I don't know what the next vet who sees this case is going to say or think about what I've done. So at that point, I started feeling as though what we needed was some clinical guidelines that looked carefully at all the options, decided what was a good use of charity resources and what was in the welfare interests of the pet within those resources, and made it clear where those decisions had come from. And that way we would gain the consistency that we needed. We'd make better use of our resources, and we'd also give confidence to our teams. And I think that, for me, is a really important point. To make pragmatic choices, you have to be a little bit brave. You have to say, well, I'm not going to do that because I don't think it's going to add very much, is actually a braver and potentially more educated decision than just reaching for the test that in theory is the right solution.
You mentioned there about 5-minute consults and almost that sort of, I think you said fibre grade medicine, but it does remind me a little bit of my first job in charity practice, where we did 7.5-minute consults, and it was like conveyor belt medicine. But at the same time, you really hone skills on things like pattern recognition, prognosis, rather than trying to find a diagnosis, and also being confident in trialing treatments and seeing response to treatment. But things have even changed within the charity sector now. I mean, standard consults are around 15 minutes, which is, double what they used to be. So I think does that sort of indicate that there is much more that's expected to be done within a consult, and there's more pressure on the vets to tick more boxes rather than, rely on some of those intuitive skills that they have?
I think it's a number of things. I think vets have become more anxious on the whole about not doing the right thing, whatever the right thing might be. It might be, in their minds, it might be applying what we call gold standard treatments. That might feel like the right thing to do. So there's more choices available. There's a lot more that you can do these days. So there's a lot more to consider and potentially discuss with an owner in the consulting room. And I think the whole delivery of a veterinary service has become so much more complex over the last 10, 20 years in terms of considering cascade and getting appropriate consent for different treatments. And it's all important stuff, but it does all add to pressure and intellectual bandwidth and time that is involved in delivering a consultation.
Can you share an example or bring to life a case where, for example, a pragmatic approach avoided costly diagnostics but might have achieved the right result for the animal?
Yeah, so I think the easiest example is abdominal masses in older cats. So, it's not an uncommon presentation to have an older cat that's a bit inappetent and is losing weight, vague symptoms, and at the physical examination, you find an abdominal mass. When we looked into these, we looked into the most likely diagnoses for these abdominal masses. Most of them, if they're sort of mid-abdominal, they're most likely to be lymphoma or intestinal adenocarcinoma. And when we looked at the prognosis for these with surgery or with chemotherapy, it wasn't great. So what we traditionally used to do was do some imaging, possibly do some blood work, and even consider exploratory surgery. What we now tend to do as a result of looking into this is just have a kind conversation with the owner about life expectancy and about just giving best quality of life they can, but making a sensible decision. And that feels a much more comfortable place to be. The prognosis with these cases is really so poor that to put cats through all these diagnostic investigations and possibly even surgical exploration feels as though for the very, very vast majority of cats, it's going to decrease their welfare rather than improve it.
That's a really good example, but I just wanted to sort of get your thoughts on something that I've talked about before, which is the changing relationship we have with pets
Mm.
over the last couple of decades, where they're considered more family members, and
Yeah.
whether that's influencing people's desire or decision making. Do you find sometimes it's the owners themselves who are expecting lots of tests or gold standard treatments because of this changing relationship? That's not just a cat, that's a member of the family. And in human medicine, we would absolutely want to do all the tests, all the diagnostics, everything possible to find out what that mass was and what we could do to extend life, not necessarily quality of life, just life, as in, numbers of days. Do you think that's a factor?
Yeah, I absolutely do. And I think not only is it a factor for those owners that really, really view their pet as part of the family, but I think it also impacts owners who perhaps have a slightly different view of the pet, that it is a transient member of the family, important, but they don't have quite the same intensity of feeling towards that pet. Because, with social media and celebrity pet ownership, it does tend to make everybody feel that they need to be doing everything they possibly can, as would be done for a human being in a medical situation. So I think it does put a lot of pressure on owners, and I think it's our job as vets to offer them a different route. I think having a discussion, obviously, sometimes it can be a little bit sensitive, but it requires good communication skills. Having a discussion to explore other options and explore what that might mean for the pet. And the benefits of not doing further investigations or further surgery, which may not benefit the pet and may even be very unlikely to benefit the pet, is an important part of our role.
And I think, guilt is well reported as one of those emotions that people
Yeah.
feel in those end of life discussions anyway. So the additional pressure could amplify that quite easily, couldn't it? And you could see how people really struggle
Yes.
and feel like they need to do as much as they possibly can and get themselves into situations that aren't great for them or the pet.
Yeah, I agree. I think guilt is really common in end of life of pets. The way an owner feels about that end of life and whether they've done enough, and it's perhaps comfortable for them to do every test and explore every option, because then they might feel that they're protecting themselves from that feeling of guilt. But I do think that there is a place for a really careful conversation about other options. And, I think some owners are actually really open to it once you start broaching the subject of prognosis and welfare and prioritizing quality of life.
I've seen lots of research that's come out recently, but it's suggesting that many, many more people are delaying vet visits because of costs. Do you have any advice for anybody that's got a pet at home on what practical steps they can take to keep their pets healthy in an affordable way?
Well, I think, vaccination is always a good start, really. We're seeing the consequence of cats not being vaccinated in the recent outbreaks of panleukopenia. We've seen evidence of that in our own hospitals and rehoming centres. So I would always promote vaccination. Um, Making sure they're getting a really good diet is important as well. It doesn't need to be a specialty expensive diet. I am very much in favor of any commercial balanced diet. When I first worked in Hong Kong, the majority of pets were not fed commercial diets. They were fed beef and rice and other sort of poorly balanced diets, and we saw quite a lot of skin disease and nutritional bone disease, just generally not thriving dogs and cats. And by the time I left, I think it was Hills and Iams had moved into Hong Kong, and the difference in those pets when they were coming in, they'd been fed a balanced diet. It was huge. It was really noticeable. So I think there's some obvious things to do like that. But I think being alert to the sort of things that can harm your pet as well. So, with a dog, make sure you've got a good recall. Make sure you have your dog on a lead when you're near traffic or when you're near other dogs that it might interact with, in an unhelpful way, and keep things that are harmful to pets out of their way. So we see the occasional case of paracetamol poisoning in cats. I saw a case just recently of ibuprofen toxicity in puppies, where the puppies had got hold of a strip of ibuprofen and had chewed it up. So there's a lot you can do to protect yourself from needing a trip to the vets. But if your pet's not well, then I think it's really important to get in there early. It may be nothing, and that will be great. You can go home with reassurance. But if it is the start of something, it's better treated earlier rather than left to develop.
When I used to work in emergency medicine, it was always the puppies that had got into somebody's handbag that had been on the floor, and
Yeah.
they usually ate the chewing gum, which had xylitol in it, and
Oh, yes.
the
Yeah.
bag of ibuprofen,
Yeah.
and usually needed to come in and
Yeah. Yeah.
to have treatment. But um, I just want to go back to some of the comments we made before about the actually veterinary profession
Yeah.
itself and some of the challenges that we're facing. Now, we often hear this term, I've heard you use it quite a lot, this term of defensive medicine,
Mhm.
where vets recommend more tests out of the fear that they're going to miss something or facing complaints.
Yeah.
And the British Veterinary Association has warned that this, combined with rising costs, is leading to some owners sort of delaying treatment.
Mhm.
How big a factor do you think defensive practice is in today's profession?
Yes, I think there is a lot of defensive medicine, but I do think it varies depending on the age or the stage of career that a vet is at, with younger vets being more likely to practice defensively, perhaps, than more experienced vets. But also some practices will tend to have a culture where they'll want their vets to do more diagnostics. I'm not implying that's to make money. It's sometimes their way of just ensuring that nothing is missed, and that clients get access to everything that's available. Um, I do think it's a very comfortable place to sit as a vet. We have to treat a huge range of illnesses of all disciplines in multiple species, and you just cannot know everything about everything that you're going to deal with. So it's a real challenge dealing with that on a regular basis. So to be able to say, yes, I'm going to offer you the next logical series of diagnostic tests, which will give us more information, is a really comfortable place to sit. And as I mentioned earlier, it does take a bit of bravery and a bit of confidence to actually say, you know what, we could do these, but I don't think they're going to add much. They might give us more information, but they're not necessarily going to help us make a decision on what we're going to do in this situation. So I do think that we could, as a profession, take a step away from defensive medicine. Again, it requires that really good conversation with the owner so that they know that there are things that we're not doing, but we're not doing them for good reasons. And I guess an owner would always have the option to disagree.
Yeah, I just want to go back to your comments there about levels of experience and the sort of confidence that might give. And I think there was some research, wasn't there, that showed that new graduates often feel less able to make surgical or clinical decisions without diagnostics. But do you think the way that we train vets encourages pragmatism or unintentionally discourages it?
When I graduated a very long time ago, there was absolutely no discussion about pragmatism. But it was a totally different time era. There just wasn't as much available. I think now, from what I see, vet schools seem to be really keen to send students to charity practices to gain experience in a very real world setting. So they're seeing what is done for clients who are sitting at that end of the socioeconomic spectrum where they're not going to be able to afford to do very much, or their treatment is being funded by limited charitable resource. So I think there is a move in the university training to try and address that gap.
But more broadly, when we consider the profession as a whole, do you think the culture of the profession may be shifting towards over-investigation? You mentioned there something around practice protocols, and a lot of, these big companies will use phrases like clinical excellence as one of their underpinning sorts of ambitions. But I just wondered, whether things like that, regulatory scrutiny and even client expectations are all sort of feeding into that trend.
Yeah, I think that there's always a fear, isn't there, of not doing something and then being blamed afterwards, being taken to the Royal College, being criticised by your colleagues. I think that is always a concern. I think that if you're working in a practice that has a practice protocol, it's probably quite hard to go against it, particularly if you're recently employed or a new graduate. But I do think there is a lot of discussion within the profession now, around contextualized care and taking that step to consider what is really in the interest of the pet in front of them and not just follow a protocol.
But Blue Cross, you're responsible for veterinary standards. How do you ensure the care you deliver is sort of both cost effective whilst also maintaining the highest possible welfare standards?
So I mentioned them earlier, but we have a extensive library of clinical guidelines, and these guidelines are to deliver that level of confidence in our teams to make pragmatic choices and to be more welfare focused. And they're not protocols as such, because we know that every clinical case is different and there has to be some flexibility. There are some things that as a charity we just don't do, like chemotherapy, spinal surgery. Some things are completely out of scope, but otherwise we will give guidance on what treatments to choose first, what tests we would generally do, what we would generally not do. But leave the clinician with some room for maneuver if they've got a case that feels slightly different to them. When we construct these guidelines, we look very carefully at the evidence. So we do a bit of a literature search. We look at recent CPD that we've attended, and we also draw on our own experience. So these guidelines are not created by one person in isolation. They're created by a team of people, and our collective experience is pretty significant, really. So we use our own experience as well. And when we suggest that a test doesn't need to be done, we will give very good reasons for why we're making that suggestion. So the intention is that we'll gain more consistency between the care that is delivered. So that gives our owners more confidence in what we're doing. Our vets and nurses will have confidence to make the choices that we're asking them to make. And most of all, the animal will benefit from more welfare-focused treatment. But it's not just a sort of, guideline that helps us deliver that care. It is a whole sort of ethos of focusing on welfare above all else, and not doing things that are not in the welfare interests of that pet. And that's something that we very much encourage.
Yeah, it was very interesting there how you gave an example of a guideline, which is there to support a vet in making a decision with the evidence base behind it, versus what you said there about a practice protocol where it would be very difficult for somebody to go against a protocol. So it's that difference, isn't it, between giving vets clinical freedom, but shaping the standards of the service. I could probably give you a really good example actually of when I used to work in a private emergency practice that had a protocol for how to deal with cats with blocked bladders. And at the time I had quite a lot of experience with this working in the charity sector. But in the practice protocol, they had things like setting up certain types of infusions and putting an ECG on every case, because obviously one of the consequences of blocked bladders is that, potassium builds up and it can cause a bradycardia or a lowered heart rate. So in the practice protocol, they had, you have to put an ECG on so you could manage the bradycardia. But I was like, you just need to unblock the bladder because that will sort out the problem with this, build up of electrolytes that you don't want. So, but I remember being pulled up about it after I'd unblocked the bladder, and I was like, the cat's absolutely fine. And if I was worried, I would put an ECG on because it would be showing signs of bradycardia, and it absolutely wasn't. But all that sort of stuff that you do adds on time and complexity in a situation that I felt was an emergency and meant to be dealt with very, very quickly. But you know that from experience, don't you?
Yes.
Of having dealt with many and many of those cases before, and having the confidence to say, I'm actually not, I don't think that's necessary. And I chatted to the owner about it, and I said, I think I'm just going to go ahead and do what needs to be done. And the owner was fine with it. But it does show that there is sometimes a pressure that a vet's under, isn't it, to comply with what the practice is, and obviously those things are very evidence-based and they are grounded in science, but actually your own experience sometimes tells you that I just need to get on with this and do it quicker, So, have you got any other examples of things that have slowed down treatment, for example?
Oh, I'm sure I have. I'm not sure I can think of any.
Well, first of all, do you agree with me not to do? It was okay not to put an ECG on that cat with a blocked bladder.
I totally agree. And, I agree with you when you say that sometimes doing these things, which in theory are to protect the animal, they actually take time. And in an emergency situation, like you say, you've just got to get that bladder unblocked, and then normal circulation can resume through the kidney, and that will sort out most of these problems. So I do agree with you. The other thing I would say is that over-reliance on tests and pieces of equipment is actually de-skilling us, as well as the sort of reliance on making a referral for certain surgeries. And I think, as a profession, first opinion vets are sadly becoming less skilled than they were a decade or two ago. They're less willing to tackle surgeries like TICAs and cruciates, which used to be very much in the domain of first opinion vets. And it's understandable. There are now a lot of referral options, and you have to give clients the choice. but perhaps we should be a little more confident to whilst giving them the choice of referral, to steer them back to perhaps having it done at a first opinion practice rather than going for referral.
And for those listening that aren't in the veterinary profession, a TICA is a total ear canal ablation, ear surgery, and a cruciate refers to a cruciate ligament surgery in the stifle or the knee joint, we generally quite commonly see in dogs, don't we? But, and this might be a big question for you, Alison, but looking ahead, what changes across the veterinary profession would help make pragmatic, affordable care more widely accepted in everyday practice?
I think, first of all, accepting it as a good option. And I think we're on our way to that. I think there's still that dislike of the term pragmatism. I think it's a shame, because I think pragmatism says exactly what we mean it to say. I think it's just the misinterpretation that has occurred around it. But I do think that, calling it contextualized care has helped to make it more acceptable to people as an option. So I think that's great. I think there needs to be more confidence in the approach, and more confidence in the reasons not to do things, to do things in a more efficient, less costly way. Having that understanding that you're perhaps not depriving an animal of something that it desperately needs. You're actually giving an animal a better quality of life, and allowing, really importantly, allowing that owner to access veterinary care. If we're reaching the point where owners won't cross the threshold of a vet because they're worried about how much they're going to end up paying, that's a really serious concern for animal welfare. And we need to do something to sort of address that fairly urgently.
So if you could give one message to pet owners about caring for their pets in a realistic, affordable way, what would it be?
I would always suggest that pet owners ask about alternative approaches, particularly if they have financial restrictions, or they're concerned that their pet may not cope with a particular approach, or they may not be able to manage a particular approach themselves. I think that those three issues should be discussed at a very early stage with veterinary care. And there are other approaches for most things. So it may well be that there's a more suitable approach that's more affordable, or is easier for you as an owner or for your pet to cope with.
And if you could give one message to the veterinary profession, especially younger vets that are starting out, what would it be?
I think just keep your skills. Don't reach for diagnostic tests. Just try and think about what you're getting from a clinical examination, what you're getting from a history. You can get so much from taking a really good history from an owner as well. And try and apply that before considering what diagnostic tests you're going to reach for. That's the best way, in my view, to develop skills. I think those are really important skills that will serve you all the way through your career. And, be prepared to be a little bit brave. It's not an easy profession to be in. It's always been a challenging profession, but the rewards of the profession are so great. In my view, there's no better profession to be in than the veterinary profession, however challenging it might be.
That's great advice. Finally, is there a person or a pet who has inspired you in your career or the work that you do? I ask this question to all my guests, but I thought I'd ask you as well. I'm sure you've come across many people and pets in your professional career, but is there anybody that's
Yeah.
inspired you?
Yeah, it's a great question. And I have come across some fantastic pets, my own and other people's pets, but I'm actually going to choose a medical writer. He's a human surgeon. His name's Atul Gawande. He's written books on end-of-life care. He wrote the Checklist Manifesto. He's done TED Talks and Reith lectures, and I could listen to him endlessly. He makes so much sense. And one of the first things I heard from him was in a Reith lecture when he was talking about his book, Being Mortal, which is about end-of-life care. And he talked about some statistics from the human arena, where he said if you consider each week of a person's life separately, the week that they are most likely to have a surgical procedure statistically is the last week of their lives. And within that week, the most statistically likely day to have a surgical procedure is the last day of their lives. So what you can get from that is that an awful lot of surgery is being done absolutely pointlessly in people. And I thought that was an amazing statistic to share. And I just felt that it made me reevaluate what I did as a vet and what I was hoping to achieve with some of the things that I was doing.
That's really powerful. Could you just repeat his name again, Alison? Because I'm definitely going to look him up.
Yeah, he's called Atul, Atul Gawande, Gawande. And he was responsible for checklists. He was tasked with creating checklists. And he went to the aerospace industry and looked at their safety procedures. And, his books are all in audio format as well. So, I can't recommend him highly enough.
Alison, thank you so much for joining me and sharing your wisdom and experience, your vast wisdom and experience. This episode has really shown that pragmatic veterinary care isn't about cutting corners. It's about using expertise and evidence to deliver excellent welfare outcomes in ways that owners can actually afford. Thank you to everyone that's tuned in, and we'll see you next time on the consult room.
Thank you for listening to this episode. You'll find all the relevant links to this conversation in the show notes. If you enjoyed it, please follow us and leave a review. It really helps other people discover the podcast. For more insights on topics like this, you can connect with me on social media at Dr Paul the Vet, or check out my website, theconsultroom.co.uk.